Hi everyone, Dr. Christopher Jonkis here. As we navigate through the COVID-19 crisis, a lot of the same questions come up. So I thought I'd take a few moments to try to answer some of the common questions that I hear on a daily basis as I do my telehealth visits. One of the most common questions that come up from patients is, how do I tell it's COVID-19 or coronavirus and not just a cold or a sinus infection or the flu? To be honest, this can be a very challenging thing to determine, but there are some typical findings with COVID-19 that aren't often seen with these other conditions. First of all, fever. The condition is almost always associated with fever in symptomatic patients at least, and the fever can be quite high and quite persistent. This is generally not seen in the common cold. Secondly, some things you may not think about or know about with COVID-19 are the following. Often it's associated with GI symptoms and particularly diarrhea. It's also often associated with a loss of taste and a loss of smell. And these are really interesting findings that are typically seen only in this condition. Occasionally I'll see someone with a bad sinus infection who can't smell, but the loss of taste and smell together is unusual. Shortness of breath is probably the most common symptom that differentiates the condition from others. With the common cold, with the flu, it's really unusual to have shortness of breath. But that being said, this can be a difficult thing to sort out by history alone. And if you have questions, your best bet is to call your doctor. If you have concerns, give them a call, and they can help you navigate through and figure out what's going on and see if you need to do anything differently or get tested. So thank you and have a good night.